Hi, I'm Cheryl Velba. I'm a patient experience ambassador at Old Bridge Medical Center. I'm also a volunteer with our pet therapy program. This is James, my silver standard poodle. He's one of the pets in our pet therapy program. James is 7 years old and has a non-shedding, hypoallergenic coat. Standard poodle breed is one of the most popular in the United States. James and I went through intensive training last year, preparing him to be a therapy dog. To earn this certification, dogs were trained to navigate around medical equipment, learning how to remain calm and focused in sometimes noisy and busy hospital settings. The training lasted 5 weeks. Each week, training was a little bit more intense than the previous one. In his training class, there were about 12 dogs and their handlers. We gradually interacted with one another. The dogs were exposed to such things as wheelchairs and walkers. The dogs were positioned in a circle, and the trainer would introduce the wheelchair to them, wheeling it towards them and maybe stopping a few feet ahead of each of them to see how they reacted. Sometimes the trainer used a walker to appear unsteady, pretending to stumble, or someone might drop a food tray. Our task was to teach the dogs to remain calm and not react, which initially was a challenge, but they quickly learned. James passed his test with flying colors on the first try. He thrived the whole time he was in training. I was pleasantly surprised because the truth is that James is an introvert, but he bonded with the other dogs and adapted well to the training. You may wonder, what does a therapy dog's day look like? Usually I make my own rounds first. I welcome new patients and I asked if they'd be interested in a visit from a therapy dog. A lot of times, when people are in the lobby who are visiting a patient, hear that there's a therapy dog, they approach me to learn more. They'll say something like, "Can you bring the dog to my father's room? He'd love to see a dog." I add their names to the list of requests for therapy visit. Some patients who've been in the hospital before and are here again already know James and will request him. We have about 4 therapy dogs in our pet therapy program, and a 5th one going through the certification process. Let me tell you about the therapeutic benefits of a therapy dog. Many studies show that interacting with a dog can benefit health by decreasing blood pressure, heart rate, cortisol, and offer a distraction from situations that cause stress. I experienced this myself when I was a patient. About 10 years ago, I was ill and was in a physical rehab facility for about 2 months. The one thing that I looked forward to, that I was happy to wake up for, was a golden retriever who would come to my room. I remember it so vividly. I thrived. Here, I see patients' faces change almost instantly when they see a dog. There was one patient who had dementia. She wasn't verbal and she had no expression. When I went into her room with James, the moment she saw him, her face lit up with a huge smile. She also tried to speak, attempting to form words. We hadn't seen this in this patient before. Seeing a dog is for many people just a trigger for happiness. If there's a patient who'd like to have one of our therapy dogs come to their room, they should call the Office of Patient Experience and put the request in. Besides James, we have Blueberry, who's a bulldog, his brother Rufus, who's a Shih Tzu, and Pisco, who's a golden retriever. Our dogs are trained by the pet therapy program, Bright and Beautiful Therapy Dogs, which is supported by Linda's Leashes, which is completely donor funded. Linda's Leashes is named after Linda Haas, a former employee of Old Bridge Medical Center and Raritan Bay Medical Center. Linda died last year. She loved animals, and her colleagues decided to start Linda's Leashes in her honor. Bright and Beautiful Therapy Dogs is a nonprofit organization based in Morris County and recognized in all 50 states. It is dedicated to transforming well-behaved dogs and their owners into certified therapy teams. Since its founding in 1999, this organization has trained, evaluated, and qualified individuals and their dogs, ensuring they meet the standards for therapy work. It has certified more than 14,000 members and their canine companions, bringing comfort and joy to those in need. James and I thank you for tuning in to learn about how pet therapists are bringing a bit of sunshine to patients each day. To find out more about our pet therapy program, please call Volunteer Services at 732-324-3265. James and I look forward to hearing from you.